Hi, everyone. This is Shirley Farrar, and you have just entered Encouragement on Fire. And I want to encourage you today. We are excited about the month of February because this is the month that we encourage you to overcome heart disease, heart conditions in your life. And how do we do that? One day at a time. So I like to start my podcast with a little encourage minute. And we want to talk about some different things that are updates regarding cancer. In our encourage minute, I do not have any statistics overall. However, what I want to say is that, you know, in this particular segment, I want to start encouraging you with the word of God. I want to start encouraging you with some scriptures. And there is a particular scripture that I want to just mention to you. And it is in Psalms 41, verse 3. And it says, "The Lord sustains him on his sickbed. In his illness, you restore him to full health." Mm. And I wanted to say that simply because over this entire year that God has brought me through so much and he got me off my sick bed. And I'm encouraging all of you that are there that are on your sick bed, or you're still in recovery, or you're up, but you're still cautious about so many different things, that you should know that God is with you. And if you will give him the opportunity, he will guide you through, he will help you through your process. And I want to give a few shout outs. I'm not going to say any names because, confidentiality, but I want to say that our prayer group that we've been praying for others, and, that they would recover through sickness, through disease, through all kinds of things. I want to specifically say that we've been praying for a young woman, and she just told us that she overcame uterine cancer. And did she receive some, you know, medication from the doctor? Yes, she did. But she is a woman of faith, and she believed God for her healing. And all of you know the statistics behind uterine cancer, but she overcame and she has the victory. So I just want to give that, you know, report. And I want to tell you that we've been also praying for some others and some victories that have been just coming. Um, and like I said, I can't disclose on, this particular podcast unless they are willing to come in and to interview, which I'm going to ask them. But I just want you to know that the prayers of the righteous do avail. There are many people becoming healed of cancer, and sometimes they're just getting healed from eating naturally and doing the right thing. Sometimes they're getting healed by doing what their doctor says and using the medications that are available to them. So be encouraged, have faith in God. Okay, everyone. So we're back from the Encourage Minute, and now we're going to talk about the heart disease. And today, as you know, is the third week in February. In the third week of the month, we usually talk about career talk, occupations that deal with whatever topic we're talking about. And since we're talking about heart disease, we want to discuss what are the occupations that assist individuals that have heart disease. I think that you're going to love some of these examples, and possibly our young people. Maybe these are some ideas that you may want to consider as an occupation or career in the near future if you're graduating from high school, or even if you're in college and you're thinking about what should I do after my 4 years of college. I'm really good in certain areas, particularly science. So I want to talk about EKG technician, or we call it a cardiovascular technician, registered cardiovascular invasive specialist. They call this so many different names, but the official name is, of course, the electrocardiogram technician, which we call EKG for short. Um, these individuals, they provide these particular diagnostic. If you hear my dogs in the back, there's nothing I can do about it. But they provide diagnostic testing, so then that we can, um, the physician can diagnose pulmonary or cardiovascular conditions. And they also obtain our records, making sure that things are in order. They ask you your medical history. They get your test results from you, as you're going from, specialist to specialist. All those things they gather together. So then the physician or the doctor can assist you better. And we're going to talk about what type of doctor it is that assists you. So as they're doing that, they're also doing the diagnostic. That is their main job requirement. And they're looking for heart irregularities. And if you are thinking about this type of occupation, I want to talk to you about the technology skills that are necessary to actually do this occupation. So you're going to need, first of all, to be able to do inventory management software. You're going to need to know medical software, that's the digital software, as well as Office Suite software. That could be like Microsoft, something like that. Most people are familiar with that, and spreadsheets, Excel. So the technology examples I just gave you, if you feel this is something, yes, I can do that, then this may be, a potential career for you in the future. Some other skills that are really important for this particular job is active listening. I think that's active listening is one of those things in most jobs, but in this particular one, because if a patient says certain things, they have to recognize, oh, that may be a flag where I need to make sure I write that down for the doctor to diagnose that later. And also for them to give their opinion, because remember, and no matter what the career is, there is a team when you're dealing, in cardiovascular disease. There is a team of people, and the EKG technician is only one member of that team. So also they have to have critical thinking skills. Now, and also monitoring. They have to be able to monitor your vitals, things of that nature, because they're going to be making sure that as they're, you know, performing the diagnostic on you, that all of these things and your vitals are also normal and not, at high degrees or even low degrees. Uh, let's see, the direct contact, you're gonna have about 94% direct contact with patients. So if you are not a patient person or you're not a people person, this may not be the job for you, because you're always going to be around people. It says 94, that means what, 6%? You're going to take a break, that basically that's what they're saying. You're going to, have your lunch break alone, something like that. But other than that, 94%, you're going to be around people. And the education is a vocational degree certification, on the job training. A minimum for this particular job or career is an associate's degree. Okay. And remember, this changes versus state to state. So you really need to inquire about your particular state, because it may not be what I'm saying. It may be something similar, but the minimum, you're going to have an associate's degree. And the salary, the minimum average salary for an EKG technician or cardiovascular technician is about 42. I've seen it about 55, something like that as well, depending on the state. And that's the middle range. Okay. All right. So remember, that's one person in the team that will be assisting someone who had cardiovascular disease. All right. Now you also have a exercise physiologist. So I know a lot of you are thinking like physical fitness, go to the gym, that type of thing. So similar. This particular individual, the name for this occupation is also certified exercise physiologist, or EPC. They could also be named clinical exercise specialist. They could also be named exercise specialist or lifestyle and weight management consultant. So there's many names, and I'm pretty sure, depending on the state, the name has changed. I encourage you to, Google, play around with those, the names that I'm giving you, so then you can look it up for your particular state. The average salary or minimum salary average for this particular job is about $50,000 a year. And this individual assesses pain, or they provide a fitness program. So I think that's really good, because when you are going through anything, and particularly cardiovascular disease or condition, or you're trying to maintain your physical fitness, you want to make sure that if you're having pain, that someone who is working with you is going to be able to assess that, no, you shouldn't do that exercise. You can do this. You need to maintain this every day, every week. I think that's really good. And I know you're thinking, well, is this like a physical therapist? Similar, but a physical therapist actually is at the doctorate level. So it's a little different. This particular exercise physiologist is more of your vocational training. They do have a 4-year degree, but some don't. So I'm just saying, state to state, it's different. Several years, they're going to have work related experience. So anytime you're going to do a job like this, it's going to be hands on, apprenticeship, that type of thing, where you're going to have to get in there and have hours of, on the job training in order for them to even consider you touching anyone or helping anyone in this aspect. And the face-to-face conversation is going to be about 95%. So again, if you do not like people, this is not for you. So make sure you're thinking of that. Electronic mail is about 82%. Most of these jobs are, because there's a lot of paperwork involved. And so you should consider that. Also, let's see, this individual, their focus is to improve your cardiorespiratory function, your body composition, muscular strength, and muscular endurance, and maybe even your flexibility. So, if you think that that's you and this is something you may want to do, I think that you should look into it. And also, this person does review your medical history. They provide stress tests that measures one's cardiovascular fitness. So there's a lot of different things. Now, technical skills for this individual, if you were considering this, electronic mail, yes, okay, so you're going to be doing that. Medical software, Office Suite again, presentation software. Most of us use, I think, Privia or something, Prizia. I can't remember the name of that one, but also there is the PowerPoint presentation through Microsoft. And then you have the spreadsheets again, Excel. All right. So in your soft skills, oh my goodness, establishing and maintaining interpersonal relationships. I think all of these, you really, it's particularly this one, because you're going to be talking with the person and as they're exercising. And, I think with the EKG, it's a little different because, I'm getting them in and out. It's a diagnosis. I'm doing what I need to do. It's more technical in that fashion, where this one is more, I think it's like a more relationship building kind of thing, because I'm going to be coming back to you a little more frequently than I would for an EKG. Think about it that way. So if I'm coming back to you, weekly or bi-weekly, I'm building a relationship with you. And I think that's important. Next one I want to talk about is the respiratory therapist. All right. So remember, we're talking about the team. There is going to be a team that helps to diagnose you with the actual doctor. And so that team, the respiratory therapist, they make about $62,000, somewhere around there on average. And, they're also called a cardiopulmonary rehabilitation respiratory therapist. They're called a certified respiratory therapist, or a CRT. They're also called a staff respiratory therapist. So there's many different names, and I'm only naming a few. There's so many different names, and you need to look them up based on your state to state. These individuals help patients with breathing problems or disorders. So, anytime the doctor says, well, I want you to go see a specialist, normally they're talking about a respiratory therapist, someone who's actually going to assist in that matter. But like I said, you could actually go to the main doctor. We'll talk about that in a minute. But a respiratory therapist is someone that would definitely assist you. And they treat the following kind of patients. They treat the chronic respiratory heart diseases like emphysema, bronchitis, asthma symptoms, excuse me, asthma. And then some of the symptoms, they diagnose conditions and they recommend treatment plans. So I just want you to know that these individuals, respiratory therapists, and let's say that you are not looking to do a career path down, to do this. However, if you're having any of these issues, this is the type of specialist that you can ask your family practitioner. I'd like to see a respiratory therapist. So it's good to know the different types of teams that are available to you, especially on your insurance. A lot of times we just go to the family doctor, right? And then we never see the specialist until something really goes wrong. But if you're having difficulty in breathing or different things, why not ask your family practitioner and say, "Can I see a respiratory therapist, or can you make me a script so I can go and see a respiratory therapist?" Most of the time, they'll tell you yes, especially if you're telling them that there's some breathing issues that you're having. And are they going to do their own minimal testing in the office? Absolutely. But remember, you are the individual that knows yourself the best, right? So if you know when you're exercising and you're really panting a lot and you're out of breath, well, the doctor, unless they put you on a treadmill in the actual doctor's office, they would never know that. So you have to tell them. Remember, we talked about, you got to write down all the little things. So you're saying, I've been walking or I was running and I'm really out of breath. You got to tell them how often it's been happening. So it's not just about having a career, but it's also about utilizing these individuals who actually do this as their occupation, reaching out to them for assistance, especially if you need it. Um, Also, these individuals, let's see, they monitor patients' physiology responses to therapy, right? And your vitals, like we talked about the other occupations. And let's see, they may use the following with patients: mechanical ventilators. We all know about that since the COVID, right? That name just seems to pop up now a lot. Anytime somebody says ventilators, I'm just automatically goes back to COVID, because that's an experience now we all will have forever. They also use therapeutic gas administration apparatus. They use environmental control systems and or aerosol generators. So these are some things that they may use with their patients. Let's see. And the same skills that we've been talking about with the other occupations, this particular respiratory therapist will have to have the same skill set. We talked about the software, the medical software, all those different things, right? Spreadsheets. Everyone on this team has to be well versed in all of these different things. So no one's getting out of it, if they say, "Oh, well, let's put it off on the other person." Nope. Everyone is responsible for being a part of the team and doing their part. I want to go to medical sonographer. Now, a medical sonographer, they make about $75,000 minimum a year. They're also called a cardiac sonographer, diagnostic medical sonographer. Let's see, registered diagnostic medical sonographer, or RDMS. We also have called them ultrasound technicians. I know everybody knows about that one, right? So there's different names that we call occupations based on state to state and also hospital to hospital. So we want to make sure that no matter what, if you're interested in these particular skills as an occupation, you begin to look up different names to search them and to research more about them. These particular individuals use ultrasonic imaging machines to capture images of various organs or body parts, such as the heart and lungs, right? So I recently went through testing. I go through testing every 2 to 3 months. I'm seeing different specialists. So I'm saying to you, if you're going through anything, reach out to these individuals. Also, they analyze images and share information with the medical group. Remember, we talked about the team, the doctor, and the skill, same as the others, but they also have another skill that adds on top of it. It's communicating with the supervisors, peers, and subordinates. So we're starting to move up on the team, right? So you have the different team, but then you start getting to supervisory positions, and that's what this one would be. It would be a little bump up, just a little bit, and they're going to be giving out some information to those that are under them. Okay. And their education, again, vocational training, but remember, has to be hands-on. That means they have to do so many hours. There's some, and this changes state to state. Okay. And I honestly believe that most of these individuals will end up with a bachelor's degree and training and on the job training. Okay. Also, we have the cardiac nurse, who is a part of this entire team. They make about $164,000 a year, and they work directly with the cardiology team to monitor progress and to answer questions that the patient may have. So you notice you really don't ask questions from everyone else. So it's the doctor or it's the nurse that can answer real questions for you. And they schedule the surgeons and they make appointments, because when you make an appointment for the surgeons, um, there has to be certain equipment, there has to be a certain timeline, there has to be a certain compliance that has to take place with our specialists, because there's not just one doctor in the room. There could be different specialists in the room, and there's a certain amount of time you can be in the room. So they know exactly the policy of the hospital, the policy of the overall, compliance for everything. So they keep their accreditation. Like, there's so many different things that are involved in this. And this particular nurse does aftercare. So they call you, they may meet up with you at an appointment to make sure all is well. They're making sure that, what has been done in surgery continues, and your well-being checks, and making sure that you're doing everything that you're supposed to, that the doctor has, you know, provided in your plan with the team. I want to talk about the cardiology physician. This physician finds and treats and prevents these diseases and cardiovascular system. They treat coronary artery disease, congenital heart defects, and heart rhythm disturbances, as well as heart attacks. So sometimes when we're going through different things, we're thinking, well, who are these people? This is the name of that individual. And we all know that this individual is going to have a doctor's degree, right? They're going to have a PhD, an MD, or they're going to JD, but they're going to have a doctor's degree. Also, even though they are required to know the technical skills that we talked about with the others, keep in mind, the more responsibility that you have as a surgeon or a doctor, the less of the paperwork you're going to have. You're still going to do paperwork, but it's going to be different in the systems. And there are going to be other individuals on the team that we just talked about who have to know spreadsheets and, office and medical software. Those are going to be the individuals that are going to really be doing that, where the doctor's going to put in their notes on the system, and then everyone else is going to have to put those notes together. And then the team gets together and they talk about the treatment plan. Let's see. We have two more and then we are done. All right. So the second to last occupation I want to talk about is the anesthesiologist. Now, I think that the anesthesiologist is the most important doctor in the room, simply because, yes, they have to have a doctorate degree as an anesthesiologist, PhD, MD, or JD, but you have to have a doctorate degree and certifications. Got to pass those exams. But this particular individual makes about $270,000 or more in the minimum. And they're also called a obstetrical anesthesiologist. I want to make sure I get that right, or a medical doctor. They evaluate information and diagnostics. complex problem solver. They also numb body parts. Not only do they put you to sleep, but they also will numb specific body parts because sometimes you have to stay awake. Anesthesiologist is really key for the surgeon when they're dealing with cardiovascular disease. And let's see, this particular individual worked directly with the cardiac surgeons and the nurses and the EKG technician that we talked about earlier. Everything is so specific. Okay, so we're talking, sometimes we look at the surgeon and we say, oh, the surgeon, yeah, the surgeon is cutting you. But think about it, that medication is just as important. You don't want to wake up in the middle of a surgery, right? And you want to make sure that your vitals stay normal throughout the entire surgery. So they're very, very, very important. And then last but not least, of course, we have the surgeon. And the surgeon, on average, surgeons make more than this, but on average, it's about $299,000 that they make on average. And yes, their education is a PhD, MD, JD, whatever. Like I said, doctorate level certifications. And remember, this changes state to state. And they have advanced medical doctor degrees. So if you're thinking, oh, well, you know, I'm going to be in school for about 8 years. Nope, keep going. Keep going. It's going to be beyond 8 years. Yes, it is. So you have to make sure that you are certified to do all of these things. But the minimum is going to be 8 years. I would say more going towards like 12 years that you're going to be in school. But you have to love school. And if you love school, then you can do this. Okay. And have people done it in a short amount of time? Absolutely. I'm pretty sure there's been many geniuses who have done it in a short amount of time. However, on average, the average individual, this is how long it's going to take you. But they have two different types of specializations. I encourage you to look them up. They analyze patients' medical history, just like all of the others do. And they have a particular skill, photo imaging software. How about that? Operating system software and human resource software, medical software. So remember, they still have to know all the other softwares that everyone else does. But these particular ones, they have to know them really well for their particular requirements of their job. I think that's about it. I think overall, you kind of know the team that is necessary for, you know, the diagnosing or the treatment plan for an individual that, you know, is going through heart disease or a heart condition. Now, are there other occupations that are vital to this? Absolutely. Today, we were really talking about the heart disease part and how they build the team in order to assist that person. So thanks everyone for joining today. Encouragement on Fire. And I hope to see you here next week. I'll talk to you soon. Bye-bye.